welcome all my viewers on Heart Mitra once again today. It's always a great pleasure connecting with all of you live. And as you are aware, we not only post information for you on a daily basis on Heart Mitra, but also we invite for you leading cardiologists from across the country who can talk to you directly as a friend. I'm very glad to welcome Dr. KP Suresh Kumar, a senior cardiologist from the city of Chennai today. Sir, welcome to the program.
Thank you.
As you are all aware, that last week was observed as the Heart Failure Awareness Week, and we did, some programs for you talking about the heart failure. How is that different as compared to heart attack, and what are the other rhythm-related issues? Today, we will be talking and deeply, seeking advice of Dr. KP Suresh Kumar on the treatment approaches to heart failure. But before I start taking your questions, let me formally introduce him. As I shared with you, he is one of the leading cardiologists of our country. And after doing his master's in medicine from Calicut Medical College, he proceeded for his super specialized training from prestigious CMC Vellore, from where he did his DM in cardiology in 1993. And now for last almost 3 decades he's been serving his patients, and he is presently working as chief cardiologist at Kaveri Hospital in Chennai. He also has fellowship of all national and international academic bodies in the field of cardiology, and he has done more than 6,000 coronary angioplasties. So you can understand from that what level of patient handling experience he has. He's also been awarded as the Best Doctor Award by IMA Tamil Nadu in 2018, and he has also got the Healthcare Achiever Award from Times of India in 2020. With this, sir, I straight away invite you and hand over the stage to you for your opening comments on this topic, and then we'll move forward with the questions.
Thank you, Sanjeev Mehra, for your kind introduction and for starting the ball rolling. And hi, viewers. Today, as Sanjeev explained, we will talk about the management strategies in heart failure. We all know that heart failure is growing in epidemic proportions in India. Why there's a lot of hue and cry about the heart failure. Now it is becoming more and more prominent because it is growing in epidemic proportions in India. And what is the prognosis? Once the person develops heart failure, what is the prognosis? The mortality is the death rate of heart failure is much higher than most of the cancers. That is, if you compare this that cardiac failure prognosis with cancer of the breast or cancer of the prostate, actually the death due to heart failure is much higher than most of the cancers. For example, the 5-year survival rate is only 50%. That is 50% of the patients die of due to heart failure, whatever may be the treatment which you give. So this is a disease which is associated with very high mortality. Secondly, the incidence is rapidly increasing globally as well as in India. Why? Because first of all, there's a higher incidence of risk factors like diabetes, blood pressure, high cholesterol, and all and metabolic diseases, obesity, lack of physical exercise. All these things ultimately lead on to the pump failure. And secondly, there's a better treatment available for the management of heart failure, for the heart attack. So people come with a heart attack immediately within 90 minutes to the hospital. We do primary angioplasties. So the survival rate after a heart attack is higher. And thirdly, the longevity of the patients have increased. All these things ultimately lead on to the pump failure. If I can quote Braunwald, he says it's the last battleground of all cardiac diseases. So it is worthwhile to know about this disease and what we can do to reduce the incidence of disease, prevalence of disease, how we can manage it effectively to improve the outcome and reduce the death rate. Thank you.
Yeah. No, thank you, Doctor, for sharing this, vital information with all of us to begin with. And as he mentions that, even though there would not be acute pains in the heart failure to begin with, like heart attack, but still the mortality rate is very very high if it is not managed in a good way. And as Dr. Suresh Kumar mentions, that many heart failure cases may not survive beyond 5 years if not treated well. Sir, what is the general incidence as well of heart failure? Let's say, if we take patients who are above 45 years old in that population, so is it a very high prevalence, as you mentioned, or it is like, not very high prevalence, but the seriousness is high?
See, the literature shows that globally, the cardiac failure patients are more than 68 millions. You are in India. What is the prevalence of in India? 1% of the population has heart failure. You consider the population of India, even 1% runs out to about 8 to 20 million. And secondly, every month or every year, it is rapidly increasing. So, very high prevalent. The impact of the disease is huge.
Okay. So it's a 1% is the prevalence, but the numbers can be very, very high, and I think we need to be very careful about that. Sir, although you touched about some of the causes of heart failure in your opening remarks, but would you like to give us a very, very specific information on that? Who can be people who may be at a highest risk of heart failure, so that they are more cautious about it, and keep on looking out and watch out for that.
Yeah, definitely, Sanjeev. If I want to re-emphasize, see the comorbid condition, that is diabetes, blood pressure, high cholesterol, coronary artery disease, heart attack. These are the patients which are at high risk of heart failure. Secondly, this is a disease associated with age. As we see a lot of people in the 80s, 90s now. As the age advances, the incidence of heart failure also increases. There are certain endocrine diseases, the thyroid problem, some other diseases which can produce metabolic syndrome, marked obesity, lack of physical exercise, then viral infection. Most of the viral, we had COVID, lot of COVID myocarditis, gradually patient got to cardiac failure. So post-viral infection, toxins, deficiency diseases, all these can produce cardiac failure. But in a nutshell, what is the common cause? We say heart attack, myocardial coronary artery disease, diabetes, hypertension are the common causes.
Okay. So if you fall into this category, so just be little more mindful that you may be at a higher risk of getting a heart failure. Sir, a patient reaches a doctor later, but first of all, he himself experiences some symptoms, which tells him that something may not be wrong and he needs to go to a doctor. So what may be the most common symptoms, if you will again like to emphasize, which a person can look out for?
The three main symptoms of heart failure are exertional breathlessness. People say when I am walking, I am feeling breathless. When I am climbing step, I am feeling breathless, which was not there before. One. Second is exertional fatigue, feeling very tired, which was not there before, or unexplained tiredness. We should be very careful. We should look for heart failure. Third is swelling of the legs, that is pedal edema. These are the three cardinal symptoms: breathlessness, fatigue, and swelling of the legs.
All right. So if you are, into that high risk category and also experiencing these three things as the doctor mentioned, then I think it's time for you to meet your doctor immediately. Sir, is it like immediately, a person should go and meet his doctors if he gets some breathlessness or, he finds some kind of a fatigue, or he should, give some time to himself, observe for a few things, and after some time he goes to a doctor. What's your guidance on this?
See, if you belong to the one of the risk factor, the risk high risk group, which I have already mentioned, and you are having these symptoms, it is best that you see your family doctor or you see your whichever doctor you are seeing, and look for signs and symptoms of heart failure. Simple things like an ECG, bedside echo, and a blood test called NT-proBNP will tell you whether you have got heart failure or not. When the person comes with a heart attack to our emergency, you do a simple ECG, heart attack, I'm not confused, and a test called troponin test, TROPI and TROPT. If it is elevated, that means definitely you are having some amount of myocardial injury or heart injury. Just like that, in heart failure, you have to take an ECG and NT-proBNP, the test. It will be elevated in cardiac failure plus echocardiography. These are the simple tests which is widely available. This will diagnose the presence of heart failure.
All right. So, so these are, three tests which your doctor may advise to you, as Dr. KP Suresh Kumar mentioned. So, when you go and meet your doctor, and if he suggests you these tests, never ignore or deny. And don't say, okay, I'll come tomorrow. You have gone there for a reason. Doctor is asking you for some tests, get it done and get it diagnosed for your own betterment. So now, once we have diagnosed a patient of heart failure, let's come on to the main topic for the today, which is the treatment approaches. First thing, is it treatable? And if yes, then what are the major treatment approaches which, as a cardiologist, you apply?
That is the most important thing about this disease. It is a treatable disease. Nowadays, we have got excellent medicines available for the management of cardiac failure. If you give the medicines, we see one third of the patients recovering fully. one third of the patients doing very well with the medications, so that they can have a near normal life. And other patients, if you again the other last third were people with advanced disease also, if you give these fantastic four medicine which are available now, they get about 8 to 10 years of extra life. That's what the data shows. So medical therapy has advanced very much in the treatment of heart failure. We have got four fantastic medicine that is called beta blockers, SGLT inhibitors, RNA, and mineralocorticoid receptor blocker. All patients is called the foundational therapy for heart failure. Nowadays, all patients with heart failure, we give all these medicines unless there is a contraindication.
Okay, so I think the good news, as the doctor mentions, is that don't worry, even if you are diagnosed for heart failure, it is treatable, and a large number of patients will get fully treatable, fully treated, or a significant improvement in life, and the longevity will happen. But even if you don't remember the medicines which he mentions, it's all right. That's not your job to remember them. But the point here is that it is treatable, and your doctor can help you. So now. Initially you mentioned that the prognosis is such that in 5 years many heart failures they lead to mortality. So now are you saying that those patients who are fully recoverable in this, so it's like fully treated and then there is no mortality and then they can live a normal and healthy life?
This is an excellent question, Sanjeev. See, there are different subgroup of patients. One, I will say, there are group of patients in whom they fully recover from cardiac failure. This is called reversible causes of cardiac failure. One is called postpartum cardiomyopathy. It's very common. It's not uncommon. I cannot say very. That is, patients develop impaired heart pumping function immediately after delivery or towards the end of pregnancy. This they invariably recover over a span of 6 months to 1 year. Second is deficiency diseases, vitamin B1 deficiency, iron deficiencies, then toxins, and these are the, or let's say another acute stress can produce cardiomyopathy. All these conditions, these are all reversible cause of cardiomyopathy. They invariably recover once they treat them for 6 months to 1 year, and after that they don't need the medicine. But this is the totally reversible cause of cardiomyopathy. I say people with thyroid disease, you treat the thyroid problem very well, their heart recovers. So endocrine diseases, deficiency diseases, toxins, drug induced, that is cancer chemotherapy take agent certain types, all these are reversible. Postpartum cardiomyopathy, all are reversible cause of heart failure. That is one subgroup of people. The other group of people, as I told you, we give all the four medicine foundational therapy. This medicine has to be continued lifelong. That's what I said is a fantastic question, because people ask, sir, my ejection fraction was 40%, now it has become 60%, I have become normal, shall I stop the medicine? They should never stop the medicine. This medicine has to be continued lifelong. If you stop the medicine, they will come back to the that impaired heart pumping function state. So this medicine has to be continued lifelong.
All right. So thank you for clarifying this. And I think very, very confidently, our doctor emphasizes that if it is because of some other endocrine issues or deficiencies, you treat that and your heart failure is fully treated. If not, those causes, then the medicines are available and you take them and, you will be leading a healthy life. Sir, we also understand that heart failure is a progressive disease as well and, keep on worsening. And we hear about other treatment options also, like devices, pacemakers. Now what's all about that, and what kind of patients may need those devices, and how do they help the patients?
Yes. So we have discussed about the medical therapy, that is one aspect. Secondly is device therapy. That's called left ventricular assist devices. All these things are available, but that's only a very, very minority of the patients because it's very expensive, the device. And third is, it goes without saying that lifestyle modification, dietary modifications, and cardiac rehabilitations are as important as the medicines for the improvement. So patient has to do some regular physical activity, restricted physical activity as advised by your doctor. Fluid restriction is very, very important. Somebody has asked this question in the chat box. See, if your heart pumping function is reduced, so if you drink too much of water, all this water is absorbed into the bloodstream. It comes and fills the heart. A weak heart cannot accept this whole fluid. So it gets accumulated in the lungs. That's why you develop breathing difficulty. That's why we ask all these patients to restrict fluid intake. And so restricted physical activity, fluid restriction, salt restriction, cardiac rehabilitations, all these things play a great role in overall improvement of the patient.
Okay, so I think cardiac rehabilitation is something which is very, very important, as Dr. Suresh Kumar mentioned. So where is although medicines and all we generally see they are available, cardiac rehabilitation, what are the sources? Are they readily available, these programs in hospitals?
Cardiac.
How does the patient get
Okay.
these things?
Actually, the stress on cardiac rehabilitation, unfortunately, is much less. It is very, very important that we should stress on cardiac rehabilitation. How we impart that advice to the patient is each time patient comes to the clinic visit, we advise the patient about what simple exercises that they should do, deep breathing exercises, some amount of yoga, and then that walking, regular walking, and some of the rehabilitation therapies are available. All these things help, but some of the hospitals, our hospital has heart failure clinics are there. Heart failure clinics are the dedicated clinic for heart failure patients, where there are people who advise you about this cardiac rehabilitation.
Okay.
And we have got
Thank you
cardiac
very much.
specialists also available.
Yeah. So no, thank you for emphasizing the importance of cardiac rehabilitation. So I'll recommend the viewers that please ask your doctor about this cardiac rehabilitation as well, and he may be able to then guide you and connect you with the right people. At this moment, I'll also like to tell to all our viewers that Heart Mitra has a cardiac rehabilitation program as well, which covers all the things which doctor has mentioned. It has stress counseling, nutrition counseling, fluid management, and it is absolutely free of cost for all the patients who have heart failure. So moving forward, sir, I think we also it's important that there are some things doctors will recommend like medicines or devices. What's the role of a patient here? What kind of lifestyle modification patient has to undertake so that he reduces the risk of heart failure complications in him?
Again, it goes without saying, as we have emphasized before, the lifestyle modification and dietary modification is as important as the medicines. The lifestyle modification, as I said, restriction of the fluid, and why we should restrict fluid, I have already explained. Salt restriction, and avoid strenuous physical activity, that long traveling and everything as far as possible, avoid. The dietary exception, again, salt restriction. That is one thing. And we tell the patient restrict fluid and frequent small meals. That's if they fill the stomach, they always have some kind of discomfort. So divide and take. Instead of taking breakfast, lunch, and dinner 3 times, you take 6 time food. Small frequent meals is a dictum, so that he will not have any breathlessness after taking food, and he will not have any stomach issues and everything. So these are the simple lifestyle modifications which we can do. Again, as I said, medical therapy, which we have discussed everything, simple reversible causes. All patients with heart failure, you look whether they have got any, whether sugar is well under control, pressure is well under control, whether any endocrine diseases which needs control. Very important is iron deficiency anemia. Iron deficiency anemia worsens the heart failure. So correct the iron deficiency, nutritional deficiencies. All these things put together improve the ultimate patient outcome.
Sir, also please guide us. Heart failure, unlike a heart attack or other things like diabetes, and also does it also run in the families? Heart failure, is it like family history one of the risk factors for heart failure? And if yes, then what should the family members do? So let's say if a parent has a heart failure, then immediate family members what they should do so that they don't get this, or it can be prevented.
See, there are certain kind of cardiomyopathies. Cardiomyopathies are the diseases which affect heart muscle, which is familial. That is, it runs in families. Certain cardiomyopathies runs in families. So you must always ask a family history. Some there are people who say, my sister had heart failure, my mother had heart failure. All this. If you have got a family history, sometimes we do the genetic counseling and genetic studies to find out what gene is defective and everything. But problem is that we can identify that, but much less we can do to correct the gene deficiency in that particular patient. But if you said, as you said, there's a family history of strong family history of familial cardiomyopathy, what that patient should do, the patient should do a simple test called ECG and echocardiography at least once in 2 years or once in 3 years, so that they will know whether they develop and look for early signs of cardiac function deterioration.
Okay, so I think this is very very important. I think as he mentions that if you fall into that category of risk factors or high risk person, then screening also plays a role. Once in 2 years, as he mentions, get the screening done. So, what are the most common tests someone should do in screening, which can find out that is he progressing towards heart failure?
It's a simple test which we do, which is freely available everywhere. Is one is ECG, other is echocardiography. Echocardiography is available in all the places. Simple test, non-invasive test, which can be done as an outpatient. It takes maximum about 30 minutes. So that will tell you that whether you have any early signs of heart failure, in which case you should initiate the therapy very early so that it will prevent the progression of heart failure.
Okay, so that's very, very important. And as it is said, prevention is always better than cure. So if you find yourself into those, high risk categories, as Dr. KP Suresh Kumar mentioned, please be vigilant. Keep on doing your screening timely and try and detect any problems timely as well. I think so. We have covered the topic very well today, and you have been very kind in answering all the questions related to it. And there's a query, which you have already answered as well. Although it's written in, Hindi, written in English, but let me, just make it simplified for you. So he's a viewer from Pakistan, and he's asking that if EF is around 40, so then what is the role of fluid intake restrictions? How much should be the fluid intake which should be happening in a patient?
We generally say restrict the fluid, that is as much as you can. People say, doctor, you have said I should take only 1 liter, yesterday I took 100 ml more. There's nothing like that. You lead your life in such a way that restrict the fluid as low as possible. We say 1 liter or 1200 ml, including your tea, coffee, milk, fruit juice, everything together. So restrict the fluid 1200 ml. It helps in a long way in preventing the breathlessness and acute heart failure worsening. All this. One more thing, Sanjeev. We talk about that NT proBNP. I told you, know. So some
Yeah.
people do it in the master health checkup. They say NT proBNP is elevated. They come running to us, sir. My NT proBNP is elevated. Do you think that I have a heart failure? See, there's a lot of other condition also. NT proBNP is elevated. That's what we should know. NT proBNP gradually gets elevated as the age advances. I told you, know, when it is more than 125, that's a universal definition of heart failure. When it's more than 125, you should suspect heart failure with signs and symptoms. However, in old people, even 800 or 900 ml is also normal. People about 80 years, 90 years, and everything. Secondly, in people with atrial fibrillation, people with infection, people with renal diseases, people with lung condition, especially pulmonary hypertension, pulmonary thromboembolism, these are the other conditions which produce NT-proBNP. So just because when the NT-proBNP elevated doesn't mean that you are have heart failure. There are other conditions also which is elevated. So when it is high, please see your doctor. He will sort it out for you.
Okay. I think this is very, very important point highlighted by Dr. KP Suresh Kumar. But I think the key things which he mentions is very clear. And I think if you have forgotten anything which he has mentioned, because some of them are technical terms, good news for you is that this program is going to stay here on this link. You can, go back, rewind this, listen to him again. But the important things which Sir has mentioned is be aware that you fall in if you fall into that high risk category. And he mentioned some of the risk factors, people who can be at the risk of heart failure. If you fall in that category, then look out for those symptoms yourself. He mentioned about fatigue, he mentioned about swelling, and he mentioned about the breathlessness. So if you have these kind of symptoms, you must go and meet your doctor. And whatever the reports come, so don't worry about them. Let your doctor interpret those reports. He would be the right person. But it's very, very important that you take an advice. And finally, I think he also mentioned that if detected timely by a doctor, and if the treatment is given in the rightful way, then most patients will live a healthy and a normal life. And for many patients, it can be reversed as well if the heart failure is because of some other underlying causes. So I think, sir, I must thank you today for coming over on the platform on Heart Mitra and helping our patients, helping our viewers understand about the whole spectrum of heart failure and what are the treatment approaches and how it should be dealt with. But before I conclude the program and thank all my viewers, I'll once again hand it over to you for your final remarks, or if there are any things which still we have missed out and you want to emphasize.
Thank you, Sanjay. Thank you for excellently summarizing the whole program and all the meaning of the whole program and what are the messages of the program. The most important thing is that early detection and starting the treatment very early will prevent the progress of the disease and the morbidity and mortality due to this disease which has got a very high death rate or very bad outcome. So it's a challenge. You have to pick the patient very early, start the treatment very early so that it can prevent the progress of the disease. And it is definitely a treatable disease where you can have a near normal lifespan, unless and provided you take the medicine regularly and take care of the other things which we have already discussed. Thank you very much
Yeah.
for all the viewers, and thank you, Sanjeev, for conducting
Thank
the.
you, thank you, thank you. And I think, as he again mentioned, it's important. That's the objective also of this program, that you learn these things as a viewer, identified yourself those symptoms so that you can reach your doctor timely. And the second thing, don't panic, nothing to worry. Mortality is high only if you don't take the right treatment or don't reach your doctor timely. So if you take the right kind of treatments which your doctor suggests, majority of the heart failure cases would be near normal. So with this, I must thank all my viewers who joined us live today or who would be watching this program later on as well. If you are anywhere in Chennai or in Tamil Nadu, you can always reach out to Dr. KP Suresh Kumar in Kaveri Hospital in Chennai if you have any further queries or issues related to your cardiovascular health. But if you are watching this program in any other city, and if you get those symptoms which he mentioned, don't ignore. Reach out to your nearest cardiologist and seek medical advice. Thank you so very much, Dr. KP Kumar. Thank you so very much for joining us, and good night.